Thanks for staying with us. I don't know what I keep talking about, but welcome back. So, it's World Hypertension Day today, and it's themed Measure Your Blood Pressure Accurately, Control It, and Live Longer. Joining us to discuss more on this is a consultant physician cardiologist at the Lagos University Teaching Hospital, Dr. Olusegun-Joseph. Welcome to the show, sir.
Thank you very much.
So good to have you. So hypertension is like almost synonymous with almost every adult in Nigeria. There's always one issue of BP, I'm using BP drugs, you know, and we've talked about it several times. But this year's theme is different. Tell us about it, about the theme this year, and why this theme?
Okay, fine. So there's so many people that have hypertension and they're not aware of it.
Yeah.
So that's one. Secondly, measuring your blood pressure can give you accurate reading or even give you something less. All right, so if you measure wrongly, you are likely to have something, you know, that is wrong, I mean, wrong figures. And that on its own can, you know, determine how management is going to be implemented. So the first thing is to measure your blood pressure accurately. We want it measured because if you don't measure it, if people don't measure it, hypertension cannot be diagnosed. And there are so many people living with hypertension that are unaware of it, not only in Nigeria, globally. More than, you know, 700 million, according to WHO, are living with hypertension and have not been diagnosed.
Wow.
All right? And that is enormous. Now, if we look at the fact that if we now come to our own part of the world,
Nigeria,
greater than 75%, okay, 70% of those living with hypertension are in sub-Saharan Africa, where we belong. Now, that tells us something, that a lot of people are living with hypertension without knowing it. So, first of all, measure accurately. Secondly, control it. Because if you measure your blood pressure and you have hypertension and you are not doing anything about it, there are so many people that, you know, feel that, okay, I don't need to do anything about it, just leave it, everything will go well. If it's not controlled, even if you know about it, there are a lot of things that will come. Okay?
So,
organ damages, you know, a lot of cardiovascular disease will crop up. Stroke, heart failure, heart attack, and the rest. Even kidney failure.
wow.
All right, will come up. And I mean, if any of those ones come up in anybody, your guess is as good as mine, that morbidity will be high, quality of life will be greatly reduced, and mortality will be high.
So, hypertension is one of those diseases that has lots of family members, like many cousins. It is not just one. And I was talking to someone who the diagnosis was badly managed hypertension, which has led to many. Worry was, what do they mean by badly managed hypertension, and how can someone badly manage their hypertension?
Okay, so that's the second sub-point in that statement. Measure your blood pressure accurately, control it. If it's not controlled, it's one way or the other not well managed. Now, the management, the poor control may come from the patient who refuses to take the drugs, who refuses to do the things that are supposed to be done, all right? The poor control can come from the physician or the doctor who, I mean, there's something called physician apathy. Someone comes to your consulting room, blood pressure of 150, 100, and you just say, oh, don't worry, just go ahead, continue what you're using.
You'll be fine.
You are supposed to review those drugs. There are so many things that can cause that. One, the drugs, is this patient really taking the drugs? So you need to find out. Secondly, is this patient taking the drugs as prescribed? If the answer is yes, then you must find out. That's difficult though, but are the drugs really, really working? Are they fake drugs or not? If they are, you know, not fake drugs, if fake drugs are ruled out, this patient gets the drugs from reputable pharmacy and the brands are okay. The next thing you need to know is that the prescription, no matter how many there are, and no matter the dosage of the drugs, they are not working for that patient. Do you understand? So if you have a drug that you can increase to 10 milligram and the patient is taking 2.5, please increase the dose.
Right.
Do you understand? And then give the patient a shorter appointment to
Because
come.
when my mom was alive, they kept reviewing and reviewing. But let me let you jump in here.
Yes.
Okay, wait.
Yeah, please, because I have a cousin who has been diagnosed with hypertension. So he's on drugs, But he was complaining to me on Sunday that the drugs are not allowing him to, perform anymore.
Okay.
So...
Ozarum.
On stage?
Ozarum.
We need to know.
YK.
We need to
understand.
understand the question, yeah.
So,
Unable to perform
the
in
doctor
the other
understands.
room.
Okay.
Hey, she has explained. You want me to spell it
But the
again?
doctor did not
The
understand.
doctor self understands what I'm saying.
We were just
So
helping
his
him.
brother, who is a doctor, told him to reduce
The drugs.
the drugs. Is
For
that going to help him? Or is it going to...
performance.
Because, everything is part of the treatment.
Okay, so the first thing is this. As one ages, performance reduces. So I don't know how old...
Are you sure YK is not reducing, though? YK is not reducing.
Oh, let's
no.
not distract from the topic.
As one ages, performance reduces. That's one. Secondly, hypertension on its own, all right, if not well controlled, can reduce performance. Yes. So, I mean, the complications come in and all the rest, erectile dysfunction comes in and all those things. So, but many people think that, oh, once you start taking drugs, if anything happens to you, it's the drugs. No. We know drugs have side effects.
Yeah.
All right? But a number of the drugs that are being used now don't have as many side effects as people think. That's one. Then secondly, we have options. Do you understand? So we know that there are some drugs that can cause, erectile dysfunction and all the rest. All the patient needs to do is to go back to his or her doctor. Go back to his doctor in this case. All right? And then the doctor will review.
Right.
All right? We also have some drugs that treat hypertension and enhance performance.
He needs that one.
We like that one.
Okay,
YK, you're not a physician. Please be
So,
serious.
doctor, I wanted to find out the difference between high blood pressure and hypertension.
They are the same.
They're the same.
Yeah.
Okay, so there are people who have been diagnosed of hypertension.
Right.
And they have been able to use lifestyle modification.
Correct.
And they are no longer using drugs.
Okay.
Is that even possible? And how can we, keep telling people the sort of lifestyle that would help them reduce the use of drugs? I have a problem with drugs.
Okay, fine. So there are a few number of patients, very small proportion of patients, that lifestyle can keep them going and keep the blood pressure at bay. Okay. But like I said, very few proportion of patients. And those are those that are in grade 1. We have grades. Time will not allow me to go into this. Okay, but mild hypertension, let's just use the word mild hypertension. Blood pressure of 140, 90, 140, 95, and all the rest. We know that high salt diet is a driver of increased blood pressure. Sure. So reduce your salt intake.
Okay.
All right,
Sugar?
and we know that there are a lot of, things that are consumed in our world now, even in our country. All right, so many fast food joints springing up and down. The noodles,
fries,
okay,
red meat,
and the rest. So the noodles. We're talking about salt now. If you cut down salt, you'll reduce blood pressure by up to 5 to 10 millimeter mercury, the upper one, and about 3 to 5 millimeter mercury, the lower one. So if you cut down your salt intake, you're doing yourself a favor.
Is it cut down or just remove?
No, not remove, because we need salt.
Yes.
It is low, not no. L-O-W, not N-O.
Not N-O.
Okay. You understand? Okay. Because if you don't, take salt, your sodium, your chloride will be reduced. They have essential things they do in the body.
All right, let me pause you for a second. I have a call from Joshua. I have a question for you. Right. Joshua, are you there? Good morning.
Good morning.
You're live. Go ahead, please.
Good morning.
Can you hear me?
Very clearly. Go ahead, please.
Okay. I'm a first-time caller.
Welcome to the show.
Good morning. I'm a first-time caller, and thank you so much for the program you're treating this morning. Yeah. Okay. want to ask the doctor. I want to find out from the doctor.
Joshua, you're listening to yourself on TV. Please speak directly to us.
In most cases, medical experts that will say strictly, this is the drug you're going to use.
I'll have to disconnect that call. I think he's listening to himself. All right, so the question I was going to ask you, which I actually forgotten, let me consider.
Maybe related to salt. So,
yes, salt. So this issue of salt, I have a problem with that because I try to be healthy in my house, for example. You know, but I have my mother-in-law and my grandmother that they've been eating salt all their life. So they don't understand when I try to make all these healthy decisions. They're like, listen, grandma is 98. Me, I'm over 70. Don't come and stop. You not use seasoning, you not use this. You know, she keeps telling me you must put now. And I'm like, we have to reduce it. But so when you get to a certain age, can you cross that line that it doesn't really matter anymore? Is it people like us, like that without age and below, that we should worry? Or once you get a certain threshold in an age, maybe 80 or something, you don't have to bother because, hey, it doesn't matter.
Well, it matters for everyone. It cuts across. All right? But then, I mean, as one ages you, the fact is that you don't want the aged ones to live a boring life. I mean, you don't want to push them.
Yeah.
Out of the
Take a big joy from it.
So you've got to balance it. All right? I mean, while you're trying to get grandma or grandpa to adhere to healthy lifestyle, all right, you also have to do it in such a way that they won't see you as this girl is so mean and everything. You understand? So, and then there are things that you can use to substitute. All right. There are also, I'm sure, as a lady, you know that there are, you know, healthy seasoners, seasoning stuffs that you can use. Yeah. So you can switch. What I tell patients is this: you don't necessarily have to stop something and completely abandon.
Yeah.
Do a replacement, you know, mechanism. Establish a replacement method. You understand? So, for example, we've talked about salt. Fried things is also a driver of hypertension. So what I tell my patients is, instead of frying everything you do, you can grill, you can boil. You
can bake.
I mean, someone will say, oh, dodo, no, I must fry plantain.
Yes, so you must fry plantain.
You understand? But if you tell the patient, okay, fine, I mean, cut down on this.
Uncle, it doesn't taste the same thing.
No.
Once in like 2 weeks.
When you start, because your taste bud is already used to fried stuff, you may revolt, you may feel that, oh, what's going on? But by the time you continue that, you understand? Your taste bud adjusts. Let me tell you, everybody has the capacity to adjust. You understand? It depends. Look, my children, when they go out, there are times that we go for functions that, oh, mine, the salt is too much.
Wow. They know.
You understand? Yes. The salt is too much. You understand? The first thing we comment about when we taste food at home is salt content. And you see, I mean, the children.
So you've never had BP issues, your own family?
No, my dad was hypertensive. My mom is. Yeah. But I am not.
Yeah.
But I know that I have that family issue.
I'm so scared too, because my mother was she managed it for many years, like 30 plus years. And I know that people around her also have family, her siblings. So I'm so scared. I don't want to fall into that part, but I've not really made any conscious efforts, you know, but now it's good to know that. I know these things, but you have to reduce the salt.
So you need to make the conscious effort. Try as much as possible to check your blood pressure regularly.
Yeah, mine is
you understand? Yeah. Once you do and you find out that it's well controlled, then, I mean, adhere to healthy lifestyle. Do you understand?
So
now,
let me take Colin, then I come to you, YK. Let me take Johnny from Warri. Good morning, Johnny. Are you there? Hello, Johnny, you're live. Go ahead, please.
Okay, Maria, good morning.
Morning.
And good morning to this great doctor on TV also. I've been listening. Maria, I can hardly hear you.
We can hear you very clearly.
Okay, yeah, you're a bit faint. Okay, but you're coming up now. You're a bit faint. Okay. Well, I wanted to present my own case. It's a bit peculiar. The lower figure of mine tends to be, well, slightly higher. So sometimes when I go to check my blood pressure, I see something like 138/87. You know, And my doctor is not really a cardiologist. He's what they call the general practitioner because, they prescribe these medications easily. I started with 5 mg amlodipine. He could hardly control it, and then he took it up to 10 mg, and he started stemming it. But what I noticed is whenever the diastolic hits 90, I begin to have a pain at my collar, the back of my head, even though the systolic is lower than 140. So I want to ask the cardiologist, how best should I deal with that? How best should I manage that? For people that also have that sort of problem, what should they really do about that?
All right. Thank you very much, Johnny. Point taken. Go ahead.
Okay, fine. Thank you very much. That's a very, interesting question and very, very important. Now, the thing is that for blood pressure, you have the upper and the lower one, systolic and diastolic. Most people put their attention on the upper one, the systolic. You hear something of, oh, my blood pressure is 180, and I'm waiting to hear the lower one. And the person just stops. And I said, no. What's the lower one? All right? Oh, my blood pressure today is 130. I said, I'm waiting to hear the lower one. And the person doesn't say anything. I said, no, what's the lower one? And the person says 100. I say, your blood pressure is high. Do you understand? There's something called isolated systolic hypertension. That is, the lower one is higher than the cutoff. Now, the cutoff, by the way, is, the blood pressure should be less than 140/90. All right? Anything equal to or greater than 140/90, as far as WHO is concerned, is hypertension. Sustained elevated blood pressure greater than 140/90 and above. All right? Now, if the blood pressure is 150/80, the systolic is high, the diastolic is normal. That's more
manageable?
That's more common in the elderly because as they get older, the blood vessels get stiffer. But in the younger ones, what I would have loved to know is how old the caller is. But I'm almost certain for most younger people, they have problem with the diastolic. Do you understand? So you have somebody having 130/100, 130/105.
That's bad.
You must still take the patient as uncontrolled because the diastolic, isolated diastolic, unfortunately, isolated diastolic hypertension is not stressed in the books for reasons we don't really know. But you as a practitioner should know that a 100 or a 110 for this person, it's not acceptable. You've got to, if the patient is on, now he told me that he's only on one drug, amlodipine, and it was increased from 5 to 10. If I were his physician, I would bring in a second drug. Most hypertensives are not controlled on monotherapy. We say it's monotherapy, on one drug. You need to bring in another drug.
Really?
Yeah. Most hypertensives need at least 2 drugs. But then the pharmaceutical world have made life a bit more easier to bear with by doing a combination therapy. So you can have one tablet that has 2 or 3 drugs. One tablet containing 3 drugs. Wow. So instead of taking 3 different pills,
right,
you take one, and that reduces the pill burden.
So if you don't have, your family don't have history of hypertension, and you maybe you're in your 60s, you haven't had any case or cause to be hypertensive, you are not, can you now start to abuse salt?
This
abuse salt.
No. Salt is sweet. Salt is important. All right. But then we know that most sweet things are the things that kill. It's just like sugar.
I heard this Yoruba phrase, Yoruba thingy. It said, Ota enu, lorenu. So that really helping. Ota enu is orenu.
So what does that mean? Let me translate it. Yeah. What your taste bud doesn't like is what is friendly to your stomach. Yeah. So your taste bud likes it. That, your stomach your health would hate it. Yeah. So sweet food that would attract your mouth isn't good for your overall health.
Yeah. Are there symptoms of hypertension that would point people to,
Headache, number
having to check
That
for
headache.
it.
I always have headache. I always have headache, so we don't know. They say it's one on this side,
Tell us some
one
of
on this
the-
side, on this
On the
side.
back.
Which side is the one for
Please,
hypertension?
thank you.
All right. So first of all, hypertension may be asymptomatic. Asymptomatic in the sense that there may be no symptoms. And that's why it's called a silent killer.
Jesus.
You understand? So silent killer. I mean, somebody can be talking, and I'm sure that you have heard of cases of people who were well, got up, went to work, and in the
died.
boardroom they slumped. Or while driving, he slumped and
died.
died.
I know
or,
people who-
you know, he slept and he didn't wake up.
Hi.
Plenty.
You understand? Or
not
this person
witchcraft.
slumped and then, was able to get to the hospital, and when they checked the blood pressure, it was 200 over 140.
Oh.
And they asked, what's going on? And he said, he has never been to the hospital. He's never, he's never been admitted. He's never been to the hospital. If the man or the woman, is spared, they'll tell you, I've always lived a healthy life all my life.
So what happened?
But the problem is that he or she has not been checking the blood pressure.
Ew.
How often are we supposed to check?
I mean,
Every day.
not necessarily every day. But if you're hypertensive, yes, you should check it very often, at least maybe every day or once in 2 days.
Okay.
All right. If you're not hypertensive, as often as you have the opportunity, check it. So let me give you
Some
areas of opportunity that opens, and
Okay.
people try to,
We have 10 seconds left.
bypass.
Right.
If you're going for a new employment, for example,
Okay.
they'll say, compulsory medical test,
Yes.
compulsory medical screening. Some people will reach out to an uncle or
To
a
do a
friend
letter
and say,
to
please just write me a letter that I am free. You are shutting the door against yourself.
Right.
You understand? You
We
go-
have to wrap up now. We've lost out of time. So thank you so much, Dr.
Where's the headache? Is it the one here or
Front
here or
here.
Okay,
here?
fine. So, usually for those who are hypertensive, they tend to have generalized headache.
Okay.
Everywhere.
For those of us that don't have that, we just don't feel like
One side, the right side, the
side.
Sometimes it's the wig that causes that one.
Most times is as a result of migraine.
Okay. All right, that's
What
all
is
we can
called
take. We have to.
primary
It's
headache.
the wig that
It's not the
causes
wig,
that
right?
It's not
Please, Wiki. That is all we can take. Thank you so much, Dr.
you
It
so
was a
much.
pleasure. We learned quite a few things. That's all we can take on the show today. We'll see you tomorrow. Bye for now.